Professor in Epidemiology at the University of Melbourne, Tony Blakely, for your thoughts on this, but also AstraZeneca, Professor. I want to start with that. The revised ATAGI advice, what's your reaction to that?
It's mixed, to be honest. On the one hand, I think it's quite astute because there is that very small risk, and maybe this measure will mean that 50 to 60-year-olds are more likely to get vaccinated. But on the other hand, as the situation in New South Wales demonstrates and what's just been happening in Melbourne, we're on a tinderbox here with Delta. It's highly likely to take off in some reasonably big way, unfortunately, in the next couple of months. And therefore, if it does take off, we need to be able to allow less than 60-year-olds to get AstraZeneca if the proverbial hits the fan.
Yeah, indeed. And my advice from the government is that people can still, if they request it, get the vaccine. I guess if Pfizer's not available, but the advice is the Pfizer is preferable for those up to the age of 59.
Yes, so I think if you want to hang out and wait for your Pfizer, which could take a little while, and you're age 50 or 59, okay. But if you want to go and get the AstraZeneca, do. The risk is something like 2 in 100,000 of one of these clotting disorders, and we're getting much better at detecting people earlier. So the chance of death from it is nearly 1 in a million, maybe not quite that small. So there is a risk with the AstraZeneca, but it is very small. There's also a risk with the Delta virus. We only need to look to Taiwan, to South Korea, to Vietnam, which have been controlling this pandemic in much the same way as Australia and New Zealand with an elimination strategy, and it's broken through there. So there is the real risk until we get our vaccination coverage up that it might break out here, and in that case, we'll be using AstraZeneca for more people, I suspect.
Professor Blakely, where are we at with those over 60 in terms of how many people, as a percentage of the population, have at least had one jab?
I'm having trouble finding that age data myself. What we can say that is at least 20% of the Australian population has had one jab, compared to 10% in New Zealand, compared to 60% in the UK. Because of the way we've rolled out the vaccine, the uptake amongst 60-plus-year-olds will be 50% or greater by now for the first dose. But with AstraZeneca, with a 12-week wait, it is quite a while till we'll get that second dose coverage up higher.
And for those over 60, certainly those over 70, the risk of COVID far outweighs. Yeah. I know it does anyway for those in their 50s, but the older you get, the more urgent it is to get the inoculation.
Yeah, as you get over 60, you're going up tenfold in your risk of death if you get COVID each 10 years, something like that. And what that means is you've got to multiply that by the probability that we'll have a serious outbreak here and you'll get infected. Now, that probability is still low, but it's going up with this Delta variant. So it's hard to do the maths. There's heaps of different scenarios here, but definitely for 60-plus-year-olds, get your AstraZeneca. The benefits they probably outweigh the risk by a long shot.
I asked the Health Minister about the hesitancy issue. He seemed sanguine about it, that there's still a majority of people, clear majority, saying they're going to get the jab. In a weird sort of way, do these little outbreaks here and there work in the favour of saying to people, look, don't be complacent?
Yeah, they do. It's not the recommended path, but they do. We certainly saw a big kick up in Victoria with vaccination. I imagine we'll start seeing that in New South Wales within the limits of our supply at the moment, which is the real problem. What I reckon will happen in the next 6 to 12 months is that we'll get to about 70% vaccinated. That is not going to be enough to achieve herd immunity. This Delta virus and any future ones will be more effective still. It's that much effective that 70% is not enough. When we do open up those borders, we will therefore see natural infection getting in. We will see people getting sick, and we will see some deaths. And I think what will happen there is when people really see that, or they understand that that's what's going to happen, we'll see it go north of 70% as people realise that, you really do need to get vaccinated here or face the consequences.
And finally, Professor Blakely, what is your sense of where that Sydney outbreak is at? Obviously, very low numbers at this point, but what should we be looking at to see whether authorities have got a lid on it?
I've said on the knife edge too many times this pandemic, so let's not go there. I am nervous though. So today, I've been working on our models and stuff, and for the old variant, last year's variant, we estimate that 90% of outbreaks will get dealt with by contact tracing alone, like New South Wales for the old year variant. But when you take it up to Delta at 5.0, it drops down to about a half maybe a bit more than a half. So that means for New South Wales people who are proud, rightly so, and also been lucky that they've managed to use contact tracing alone last year and up till now, just take it with a bit of salt, New South Wales people, because this one is that much more infectious. I hope you can deal with contact tracing, I really do. And I think you've got a better than 50-50 chance, but it's not much more than that, and there may need to be more restrictions put in place. This person has been out in the community. He got it from somebody else in that limousine. They may have passed it on to other people. This person has passed it on to others. It is quite likely that there's a dozen or so infections out there in the community, I fear.